I think it's really important to know preparation for conception happens way before you even think of conceiving. I'm talking about mid-20s, having a discussion about understanding your body, whether it's an ultrasound, hormones, or just what your reproductive goals are. It's really, really important to address that early on, not just the month before you want to conceive. It's a lot of listening to the patient, understanding what their goals actually are, and being realistic of the outcomes, because sometimes you might have grandiose dreams, but based on your age, your comorbidities, financial burden that you can handle, you have to be very realistic about outcomes. A lot of studies have shown lack of sleep really affects your hormonal balance and could affect your ovarian reserves. In a world of situationships, high divorce rates, and women that really want to further their educations and career, these discussions should be upfront, not after the fact. You can't afford anything in life. How are we going to afford basic reproductive care too,
Welcome to Dismantling You, Dr. Ravikumar. I am so excited about our conversation about all things fertility. But before we dive into it, I'd like to ask you the hot topic, which is, what's one thing about fertility that every woman should know about trying to conceive?
I think it's really important to know preparation for conception happens way before you even think of conceiving. I'm talking about mid-20s, having a discussion about understanding your body, whether it's an ultrasound, hormones, or just what your reproductive goals are. It's really, really important to address that early on, not just the month before you want to conceive.
And that's such an important perspective because so many women assume that fertility is guaranteed, and it's not.
100%.
You started your career covering all aspects of OBGYN and then transitioned into fertility medicine. What specifically drew you to the field of reproductive endocrinology and infertility?
Of course. So my main focus was GYN medicine, whether managing the patients hormonally or surgically. My main patients had pathology in endometriosis, PCOS, fibroids, uterine polyps, and as one would anticipate, that directly correlates into affecting reproduction. So understanding that pathophysiology and that continuity into fertility was really a natural step.
You worked at major institutions like NYU and Mount Sinai before you transitioned over to Sher Fertility. What initially drew you to Sher Fertility?
I think Sher Fertility emulates the kind of care I like to give my patients. I get to have the time to sit down, not rushed, have a consultation that's thorough, email, communicate, call, build a relationship. I follow them throughout their journey, their procedure, and recovery. This was something you typically don't find in hospital settings where you have like maybe 20 patients on a panel and you got to keep moving. And sometimes the cases are booked with other physicians and there's a little lack of continuity. So that's the big draw that I had to Sher Fertility. It's how I would like to practice medicine.
What does truly patient-centered fertility care look like in your practice?
It's a lot of listening to the patient, understanding what their goals actually are, and being realistic of the outcomes, because sometimes you might have grandiose dreams, but based on your age, your comorbidities, financial burden that you can handle, you have to be very realistic about outcomes. And that changes throughout even one cycle. So listening to them throughout the process is really important. It might change based on their response, the medication, the side effects. So revisiting that and really listening to them and being really frank about outcomes is how you get patient-centered care.
That collaboration can be so impactful for patients. Now, there's growing conversation about the name change from PCOS to now PMOS. Yeah. And do you think this name change can help patients better understand these conditions?
100%. It's been a long time coming. I'm actually surprised it took so long, but it's here. I think that misnomer was quite an issue because patients quite literally thought they had multiple cysts on the ovaries, and that could not be farther from reality. It's such a complex system, and that name really addresses it. For example, polyendocrine, it involves multiple hormonal systems. Metabolic refers to insulin resistance, dyslipidemia, ovarian, the anovulatory, androgen imbalance, as well as syndrome. It could present in all sorts of ways. So when you say that out loud, even as a patient, you're going to seek the right care, get what you need, and have outcomes that are much, much better for whatever your goals are. So I'm really happy they did that.
Many women assume that fertility struggles happen later in life. Are you seeing changes now with younger patients struggling with infertility?
100%. I have a lot of women that are just coming randomly walk in their early 30s just to freeze their eggs. And I'm finding that their ovarian reserve, which is assessed with the follicle count and blood work, is a lot lower than you would expect. Now, it could be because, our parents just had kids earlier, so they masked that effect later on in life. Or I do think there's a factor about our food quality, our environmental toxins, our stress level, lack of sleep. I really do think it's affecting us. So I'm seeing a lot of reserve that's not what I expect for women of certain age.
What are some signs that someone should consider seeing a fertility specialist sooner rather than later?
While I do think everyone should have a baseline assessment at around 21 to 25, things that would incite earlier visits could be if you have any symptom really, if you had irregular menses, heavy menses, painful periods, pain with intercourse, pelvic pain, anything really. I think it's really good to understand what's going on with your body and not kind of brush it under the rug.
You have extensive experience in minimally invasive gynecological surgery, including treatment for endometriosis and fibroids. Are these conditions related to infertility?
Oh, they directly correlate and affect fertility significantly. Endometriosis creates inflammation. It can decrease the quality of eggs. It can take over ovarian tissue, decreasing your ovarian reserve. Fibroids, based on their location, can block fallopian tubes, can affect implantation, creating recurrent pregnancy loss. So these are direct correlations with what I deal very closely with day to day.
So for people who are just starting to figure out they want to go down the IVF path, what do you wish they understood physically and emotionally about the process?
I think the important thing is emotionally is it's very important to have a good support system. With the entire IVF and artificial reproductive techniques, this is not anyone's primary goal. So it's already very emotionally loaded before they get into it because it's something they didn't want to do, didn't anticipate they needed to do. So I think having a good support system does more wonders than you believe. And two, it's not as intimidating as it is. A lot of women, once they've done egg freezing or even done an IVF cycle, they're like, oh, that's not as bad as I thought it would be. But having a physician that walks you through everything, a nurse that guides you through the process really decreases the intimidation of it all. So it's not as bad as you think, is what I'll tell you.
That support speaks volumes, absolutely. How do you balance evidence-based medicine with individualized treatment plans when every fertility journey is so different?
We base everything off evidence-based medicine. And I think what I love about Sher is we really understand the pathophysiology of what's causing infertility. So our treatment plans are curated to counter that. So that's why we have some of the more challenging cases, women in their mid-40s, really decreased ovarian reserve, and we're able to do good things for them because we curate evidence-based medicine to the pathology we're dealing with. And we adjust every protocol based on a patient's response. So no two patients end up having the same cycle. And even the same patient will have different changes per cycle. So I think that's how you play with both of those.
Mm-hmm. Many patients are hearing about ways to save on fertility medications, such as at big box places like Costco Wholesale and deep discount drug programs. From your perspective, what do you want patients to know and be aware of? And what are the pitfalls or advantages of going down this route?
From what I understand, they should always provide the same sort of drug with the same efficacy. I don't believe you're allowed to sell different efficacy medications. I know there are some new third-party vendors that are doing donated medications. You just got to be careful, make sure that they have a system to regulate and make sure they're not expired and that they're, FDA-approved quality. But a lot of these services do offer cheaper prices for patients, and I think affordability in this realm is humongous. So I'm glad newer places are offering better solutions, really.
You emphasize shared decision-making with your patients. Why is that especially important in fertility care?
It is so important because a lot of the outcomes is a little bit predetermined. So 80% of it is your age, what your ovarian reserve is, what your comorbidities is. And we kind of use protocols to get the best of what your ovaries can do, but it's not a home run always, and it's not a guarantee. And it might be a longer journey than a sprint. So having an open discussion about outcomes and possibilities helps the patient emotionally, financially, physically really understand the process. And even if it's not a baby at the end, if you're just open and honest, it leads to happier patients and happier cycles.
After receiving over 1,000 five-star reviews, what do you think patients remember the most about how a doctor makes them feel during fertility treatment?
I think I tried to create a space that feels safe, that there's no intimidation, that you should feel free asking questions, no matter how silly you may think they are. They're never silly questions. And I try to make every patient feel human. So whether it's if I remember that their favorite hobby is skiing, that they went to Tulum recently, their daughter's name, I try to give character to our relationship. And I think that helps a lot. They're just more than patients,
I think that's such a powerful reminder, making them feel seen and heard. Are there lifestyle factors today that you believe are having the biggest impact on fertility outcomes?
100%. I think, like I said, once again, I think food quality is a big issue, and I'm kind of spiraling a little bit, trying to find food that's organic, no chemicals, no preservatives. There's a lot of toxins, even in environmental substances we use, whether it's fabrics, bottles, you name it. I think these affect us. The stress of day-to-day life, in this economy, lack of sleep. I do think all of those play a role for sure. And affordability. If you can't afford anything in life, how are we going to afford basic reproductive care too, So I really try to figure that out if I can.
What conversations about fertility do you think society still avoids or doesn't discuss openly enough?
I think we wait too long. I still think that we have this conversation like, oh, if you're in your 30s and you're not married, because I thought I was going to be 28 with 3 kids, but that's not true. In a world of situationships, high divorce rates, and women that really want to further their educations and career. Exactly. These discussions should be upfront, not after the fact. Yeah. If I had a nickel every time a woman said, oh, if someone told me earlier, So I want to tell them earlier.
Fertility medicine has evolved tremendously over the past decade. What advancements are you most excited about now, especially with AI?
I think with AI, there's a lot of cool potential. One thing that we, for example, offer in Sher Fertility is Violet. It's an AI technology used to assess egg quality. So for example, if you had an embryo, you could actually sample the cells outside the embryo and see if it's chromosomally normal or not. But with eggs, you don't know. So God forbid you had poor quality eggs frozen and you didn't know. And when you thawed them out later, guess what? You don't have any embryos. So to avoid that, AI technology like Violet scans the eggs you have, compares it to a huge database of morphology of the eggs and gives you a score about quality. And with that, you can make educated decisions of if you need more cycles or you kind of have met what your reproductive goals are. So that's one example of how I think AI is really going to change the field.
It's amazing to hear because we've just scratched the surface and it's going to improve outcomes, no doubt. Outside of medicine, you dedicate time to volunteering and community education. How has that shaped the way you connect with your patients?
Oh, so significantly. I think it helps me understand people from different cultures, religions, communities, socioeconomic levels. So that allows me to empathize with them more, be patient with them, and provide them the space to voice their concerns.
What continues to inspire you in this field, especially during emotionally difficult patient journeys?
I think the patient's resilience. I do not underestimate the emotional, physical, psychological, financial burden of everything that they're going through. And the wins really do help. Whether it's a woman who froze her eggs and now she is lesser burdened by the responsibility of having kids later on in life, or if I'm able to do an ultrasound and show the couple their first heartbeat of their embryo. Like those moments really help persevere through the tougher ones.
I can imagine fertility medicine comes with like such highs and heartbreaking lows, no doubt. For someone currently struggling with infertility and feeling hopeless, what would you want them to hear today?
I would say talk to your physician. It's not uncommon that I've heard patients say, I was turned away because you don't fit the stats of outcomes for certain practices. And the one thing I do love about Sher Fertility is we don't turn away anyone. We have a conversation with you. We're very realistic about your outcomes, what the journey looks like. And if that's appropriate for you, we support your dreams, your goals, and your desires by just having a very candid conversation. So find the right care team. And you might find out that there's options you didn't know existed.
Someone needed to hear that today because infertility can feel so isolating. Definitely. Let's do some rapid fire.
Okay.
What's one fertility myth you wish people would stop believing immediately?
that you should wait till your mid-30s and you haven't conceived yet to be assessed. That's a myth I'm really trying to battle.
I endorse that. Is there a perfect age to freeze your eggs?
Well, there's no perfect age. It is ideal in your I'd say 22 to 28. It's more bang for your buck when you do it when you're younger. So that's probably the most ideal, give or take.
What's one lifestyle habit that can quietly hurt fertility without people realizing it?
I think sleep disruption. A lot of studies have shown lack of sleep really affects your hormonal balance and could affect your ovarian reserve. So whether it's, drinking, smoking, substance use, or stress, I think sleep is underrated.
Yeah.
It's something you can try to correct.
If someone is trying to conceive, what's the first thing they should actually track?
Ovulation helps. Understanding your body at baseline is very important. So if you, for example, were tracking your ovulation using LH kits at home and seeing when you surge and understanding your rhythmic cycles helps a little.
What's one fertility trend on social media that makes you cringe?
There's a lot of supplements that are like, oh, boost your egg reserve in 30 days or, change your uterine lining. There's no miracle supplement, unfortunately, that does that yet. Maybe soon, but not yet.
Right? Because this podcast is based on dismantling belief systems and thought patterns, what's one belief that you had to dismantle personally in your life or career?
One thought pattern that I'm still currently working on is I'm a perfectionist. When I did surgery and I took out a tumor, I was like, yes, I pat yourself on the back, you took a tumor out. But with IVF, you are working with a base that, like I said, 80% is biologically predetermined. And while I'm trying to curate the best outcome, it's not always guaranteed. So while I am very hard on myself, I try to give myself grace and try to figure out how I can provide better outcomes for those patients.
I love asking questions to the most accomplished people because they have to unlearn beliefs that once held them back.
Yeah, I take it too personally.
Right? What does self-care realistically look like for you now?
A work-life balance. This can be very emotional. It can be a little bit stressful. So I try to do things that keep me happy, whether it's time with family, friends, cooking, working out. I'm obsessed with the new superfoods, whether it's sardines or sprouts.
Yes, me too.
Things like that kind of keep me balanced and level-headed and happy.
Where can listeners connect with you and perhaps sign up for a consultation?
Sure. You can follow us on Sher Fertility New York. But even if you put sherfertility.com, you can get a consultation with us. We're pretty accessible in many venues and even Google.
Perfect. Well, thank you so much, Dr. Ravikumar, for coming in person today.
Thank you so much for having me. It's been an absolute pleasure.
My pleasure.